Norwalk Community Center, and all those programs are great. But again, we're doing that through many of the agencies through early childhood. And there is where I talked about the link. The South Norwalk Community Center could link up with our early childhood program, our after-school alliance, our continuing with care committee. All of the nonprofits have come together instead of having silos of information separate and have turf battles, now all work together. All of that is being done through early childhood, after school, our community health center to deal with childhood obesity. They don't ask about citizenship, they don't ask about income. Again, the Center for Global Studies with the young people who are there, championing the day workers who are being taken advantage of by not being paid, helping them file complaints. We've worked with them. All of the things that you are doing, we're doing on a city, and this is what I talked about with the new South Norwalk Community Center. It's the relationships that we can establish where we can augment what you're doing, and you can join all these other agencies that are working with us to collaborate on all of the issues that you have talked about, all of them. We're doing it. We can do more. Can we do it better? Of course. But you might want to talk to the state and the administration up there about giving a little more funding to all of these organizations, including the Latino agency. $349,000 for the entire state for Latino events or affairs. You got $100,000. You're doing better than most of the rest of the state. So, again, cooperation, but we are doing this. And this picture that's being presented that we're not is not accurate. Go to our website. You'll see what I'm talking about.
Again, we cannot let the South Norwalk Community Center fail. We have to be a partner. We have to work with you. We have to help you get your programs implemented. And we have to do everything we can to make sure that you're properly funded. We need to be up at the state with you. We need to be championing your cause to get more money up at the state. We also have to make sure that the people who need the programs are getting access to the programs. That's where the problem is. Yes, there are programs, but are the right people coming to the programs? 47% of our student population is Latino. We can't keep doing the same things over and over and over again and expect different results. We need to try new things. We have to get young people to these programs. We have to integrate the parents in the programs. We have to teach the parents how to work with their children, how to work with the South Norwalk Community Center. All these things are important. English as a second language, after-school programs, using priority school monies that the city of Norwalk gets to help people assimilate into the culture and feel more comfortable. Right now, that is not happening to the degree it needs to happen. And we may think it is, but again, if I were to ask a show of hands, how many people think that all the young people in Norwalk of a Latino background are being helped the way they need to be helped? I think you would probably agree with me that it's not happening as much as it should, and we can be doing more. So yes, we need to be up at the state of Connecticut asking for more money, and we will be there with you asking for more money and making sure that you get it. We cannot let another social service agency fail without doing something to help them.
Well, there again is the disagreement. There it lies. The statement that there's not enough people coming in. How do you quantify that? How do you know? I walked out into the street and I talked to people, they don't have enough service. I will guarantee you, if you go to any group in this town, especially parents and Row 8 and everything, they will all say, there's not enough for the kids to do, there's not enough to go out there. And again, what I tell them is, you got to be part of it. And some of the things that we do, we have the adult education course that for high school graduation, many Hispanics, I've been to their graduations. Go there, it's a bilingual, they assist them in getting their high school degree. The parent training, leadership training has been about how parents can get involved. The community health center goes outreach. We have a mobile health van to go out. It's all being done. Can we do things better? Who is it? We're all human, we can all be better. But I'm telling you, it's not for a lack of trying. And as far as the 47%, the Latino test scores are going up in the schools, and they are treated, and we have a new superintendent who happens to be Hispanic, Dr. Rivera. He understands better than anyone, because he told a story about the discrimination he faced when he was growing up. So we're doing those things.
Well, thank you so much to